So today's guest is Dr. Jerome Adams. He's the former US Surgeon General, anesthesiologist, public health leader, and an advocate for health equity. And in 2014, he was appointed Indiana State Health Commissioner by then Governor Mike Pence, of course, later Vice President Mike Pence, where he led responses to outbreaks of Ebola, Zika, and a major HIV crisis, possibly good practice for what was to come. 3 years later, he became the 20th Surgeon General of the United States, appointed by President Donald Trump. And in that role, he led efforts to combat the opioid epidemic and untreated mental illness, and of course, played a central role in the federal government's early response to COVID-19. Today, he serves as a presidential fellow and professor of practice at Purdue University, where he focuses on health equity, policy, and public health communication, and remains a leading voice on public health and policy. And I think it's safe to add to that very impressive list a longtime Ames friend. So, Dr. Adams, welcome and thanks for being here.
Thanks for having me. That was quite a mouthful, but really glad to be here with you today, and a lot to talk about.
Indeed. So that's the resume, and we'll get to all of that, of course. But first, let's go back to the beginning a bit. So you grew up on a farm, is that correct, in rural Maryland? And
Correct.
you've spoken a bit about how that has shaped you and your later life. So maybe tell us a little bit about your upbringing and how you went from farm life to medicine.
Well, that's a lot of what my affinity for Ireland stems from, quite frankly, and why I enjoy where I am now in Indiana. It's a state that certainly has metropolitan areas, but most of the state geographically is rural. And so I grew up in a rural community. I think there are wonderful things about rural communities. The way the everyone knows everyone else. The Particularly in rural communities, the access to fresh fruits and vegetables. We had our own garden growing up and would grow our own foods. I remember going to the state fair and how fun that was, or the local fair. There. And so a lot of positives from growing up in an environment like that, but to be fair, also a lot of challenges. Challenges accessing healthcare. One of the things I talk about in my book is how I had an asthma attack growing up that was triggered in many ways by living in that rural community. Anyone who's grown up in a farm environment knows that there are certain times of year when there's a lot more dust and particulate matter when you're harvesting crops. And that was a big trigger for asthma. And when I would have these attacks, the nearest hospital was almost an hour away. And that hospital was a critical access hospital, which didn't always have a pediatrician on staff. Certainly didn't have any experts in pediatric immunology and asthma care. And so I almost died when I was 8 years old because I had an asthma attack so severe that I had to be flown by helicopter to Washington, D.C., to Children's Hospital, to find people who were qualified and capable of treating a case that was as severe as mine. And so I say all that to say that uh, even when I was 8 years old, I understood that there were different opportunities in different places for people to be and to stay healthy. And now, as an adult, I've been very open at the Ames Summit and in my public speaking about my brother who has substance use disorder. He still lives in that same rural community I grew up in. And it's been really hard for him, even beyond the difficulties of stigma and overcoming addiction, because he doesn't have access to treatment the way that you would in an urban or a suburban community. He doesn't have access to recovery-friendly environments where he can get a job. And then transportation continues to be a barrier. What Getting back and forth to treatment and keeping a job, particularly one where you've already got two strikes against you because of your history. So that was a lot. But again, we could talk for an entire hour about the challenges to being healthy, being in a rural community. But again, as I mentioned, also some of the assets of being in a rural community.
So did all of that, do you think, inspire your decision to go into medicine?
Uh, Honestly, no, because I also talk about in my book how even though I had straight A's all throughout my K through 12 education, That's not totally true. I got 1B in a choir class because my course teacher didn't like me. So I finished high school with all A's and 1B. But I could have been anything based on my aptitude. But I had never met someone, had a conversation with someone on a personal level who was a doctor.
Mm.
Of course, saw many doctors in the hospital, but no one who I could relate to or who looked like me. And so it just never was on my radar screen. I actually went to school to be an engineer. And when I was in college, I met Dr. Ben Carson, famous neurosurgeon, at an event that was being held at our campus, and that's when I said, "Huh, I guess there are doctors who look like me," and I decided to go the pre-medical pathway. Now that said, once I made that decision, it was pretty well ingrained in me that I was going to speak up for underserved communities, that I was going to be a voice for rural communities, for marginalized communities, for people who grew up poor, for people who come from different racial and ethnic backgrounds. And so my upbringing is something that I've always brought with me and tried to carry forth. But certainly growing up in that rural community, if anything, it limited my vision of what was possible. And that's why I'm so proud now to be in a position where I can talk about these things and where hopefully some little kid in a rural community, some little kid who's black, some kid who's poor, can see me and hear my story and say, "Well, gosh, I could be a surgeon general one day."
So there are many, many doctors, obviously, throughout the United States. But how does one actually become a surgeon general?
Well, being a surgeon general is a political appointment. So there are certain qualifications you have to have. You have to be a physician. Um, and so you've got to be able to make it to and through medical school. And in general, beyond that, you've got to have achieved some sort of recognition for excellence in your field above and beyond being a physician. But you've also got to get on the radar screen of the person making the appointment. And the really short version of my story is that I've been involved in organized medicine for throughout my career. The American Medical Association student section, and then my state medical association, where I got on the board of trustees. Um, my specialty society, the American Society of Anesthesiologists, and in those roles, I got to go to D.C. and speak to our legislators. And one of those legislators was then Congressman Mike Pence. And so I initially got on his radar screen, became familiar with the priorities that he had and that policymakers at that time had. And Congressman Mike Pence became Governor Mike Pence. And when he became Governor Mike Pence, he needed someone to run his state Department of Health. And I was on the State Medical Association Board of Trustees, and my name got thrown into the hat. And I was blessed with the opportunity to run the Indiana State Department of Health during Ebola, during the Zika outbreak, during a large HIV outbreak that received national attention. And I like to think I handled those situations well. But even more than that, nationally, many people thought I handled those situations well. And when Governor Pence became Vice President Pence, my name was thrown into the hat to be Surgeon General of the United States. So that is my pathway to becoming Surgeon General. There are many different pathways to get on someone's radar screen. But again, that's something that's interesting and unique about the American system. We do have political appointments in the Irish system and in other systems, but I wouldn't say that traditionally they're so political leaning as opposed to expertise based. Whereas in the United States, you've got to be at least not um, uh, in opposition to the party in power in order to get these roles. And the more aligned you are, the better. And for me, I'm an independent, not a Republican, but I happen to run Pence's State Department of Health. And so that's how I got my foot in the door.
So I think you've shared that you took the role maybe despite advice from your wife and some friends, as the administration at the time was seen I suppose by many as hostile to African Americans in particular. And you've spoken powerfully sort of about what it feels like to be the only in the room,
Mm,
whether that's from your rural background or even down to, I think you said that you were the only one sort of who was a dad to young kids at the
mhm.
time of the pandemic. So how did you kind of carry that weight or sort of reconcile that weight? Or how did you decide, I'm going to do it. I'm going to take the role.
Well, it is a weight to carry when you are the only, and as you mentioned, uh, countless times in my life, I was the youngest person in the room. I was the only person of color, in the room. I was the only person who had kids in the room, the only dad in the room. I was the only person who wasn't of the same political orientation of everyone else in the room, and it's hard. It's hard, but my parents instilled in me never to be afraid of a challenge. I come from a military family, and I'm a big believer in public service. I think that's one of the biggest threats to our collective health and societal success at this point in time is so many good people are reluctant to get involved in public service, and at some point we're reaping what we sow, and what we're sowing or planting are people with less and less expertise who are more and more politically oriented because the good people, the better people, and the more qualified people aren't willing to serve. And so I
Mhm.
strongly believe in public service. Um, and also, to be honest, and I've been open about this, I'm a Christian. Um, and when you read the Bible is full of reluctant heroes. And not that I call myself a hero, but Noah, Moses. Even if you're not a Christian, you're familiar with the stories. Even Jesus himself, they all doubted whether or not they were the right person for the job. They all said, you don't want me. I'm not qualified for this. But if you believe that if you're there for the right reasons, then I think people will rally around you, and good things will happen. And that's what I found in my career is that even when I was doubtful that I was the best person or the right person, as long as I put my head down and did the best job that I could, and really thought about other people first, I think that's key too. To being a public servant is being, the word there is servant. I'm a big believer in servant leadership. If you're willing to put other people in front of you, and then people will give you the benefit of the doubt. They'll rally around you. They'll support you when you need help, and you'll find that in many cases you can do a better job than what you ever imagined.
So you take the role and you had this very unique or maybe unlucky experience of being Surgeon General when COVID-19 hits. I mean, that was obviously an unprecedented time in our medical history, entire history. And so then in 2023, you published Crisis and Chaos, Lessons from the Front Lines of the War Against COVID-19. And you've said that writing that felt a bit like reliving a kind of PTSD. Um, what did you mean by that? And what was it sort of really like being in the White House during that time?
Well, it was challenging. And I was speaking to a group of young people about this the other day when we were talking about leadership. You get into these big roles and you have all these ideas and plans about what you want to accomplish. And you're in those roles for a few hours or a few days, and then the first crisis hits. And and it's very easy to spend or feel like you're spending the majority of your time putting out fires as opposed to advancing the issues that you care about. So when I came into um, office as Surgeon General, it was right as we had three Category 5 hurricanes barreling down on the southern United States. Historic. The first time you had three Category 5s in a row. And I was in charge of the largest deployment of public health service officers in history to that point for the three Category 5 hurricanes. That was superimposed on top of the opioid epidemic, which was killing a person every 10, 11 minutes. And that's what I initially had planned on focusing on when I came in. And so, one of the things that I think is important in these roles is to always know what your North Star is, always know what you're there to accomplish. And for me, it was to make sure we were lifting up marginalized communities, making sure we were correcting broken systems. And so, even as we were responding to the hurricanes, I was pointing out the fact that Puerto Rico, which got hard hit, is often little thought about when we think about United States citizens. They don't have the access to the same monetary resources or even the same representation that other people have. And so it was an opportunity to deal with the acute crisis while bringing up additional health equity issues that those people often face. In regards to the opioid epidemic, it was an opportunity to shine a light on the rural communities that were being hard hit by heroin and prescription drug misuse, and now fentanyl overdoses that are occurring. And so uh, I think the key for me is always not letting the crisis overwhelm you and not letting it distract you, but trying to figure out where those Venn diagrams overlap and you can deal with the crisis in front of you while also focusing on part of the issues that you deeply care about. The bad way of saying it, I think, but the way that most people are familiar with is never waste a good crisis. Um, you don't want crises, but they do provide opportunities to highlight issues, particularly in broken systems. So another great example of this is in Indiana when I was state health commissioner. We had the largest HIV outbreak related to injection drug use in the history of the United States. And it gave me an opportunity to shine a light on the prescription opioid epidemic that was occurring and that sparked that HIV outbreak at the time. It was largely due to injection of a prescription opioid called Opana. It allowed me to lift up the idea of naloxone as an opioid overdose reversal agent, and it allowed me to get syringe services programs legalized in the state of Indiana. They were previously illegal before that. And so this crisis that significantly impacted a large number of people in the rural community in which it occurred also was an opportunity for me to help thousands, tens of thousands, hundreds of thousands, maybe even millions of people by giving me a platform to lift up issues that were impacting not just that community, but all of America.
Do you feel it was a little unfair? Just, you mentioned all of those other crises that in some ways we almost forget because of COVID-19 was so impactful to everyone and not just some. Do you feel it's a little unfair that a lot of what you did or what you were involved in before that has been maybe slightly overshadowed just by virtue of what came later?
You know, unfair. I don't feel it's unfair. I feel it's unfortunate, and not that it's because of anything that has to do with me, but the idea that we're always playing whack-a-mole, and that we deal with a crisis in the moment, and then the next day there's another crisis, and we forget about what happened before. A great example of this just happened recently. Um, most people listening will be familiar with a lot of the tumult that's going on right now in the United States over vaccines and over the way that we are looking at approving and discussing vaccines. And so one week, I've got media calling me, asking me to come on and talk about the fact that Secretary Kennedy fired all 17 members of the Advisory Committee on Immunization Practices, a committee that had been around since the 1960s. It had never before been politicized in that way. That was one week. That was on a Friday. And then by Monday, no one wanted to talk about that issue because they wanted to talk about the Medicaid cuts that were coming in the big, beautiful bill. And so that's an example of the challenges that we have with messaging in this crazy world that we're in right now, where an issue seems like the end of the world or is the big thing everyone wants to talk about in this moment. But literally, it's until the next headline, until the next day sometimes when something else comes up. And so it makes it hard to stay focused and to keep the public's attention. That to me is what's more unfortunate than anything. During COVID, we seem to forget about the fact that there were still people dying from opioid overdoses, from suicides, and so on and so forth. And so, one of my challenges, one of the things I try to do is figure out how we can walk and chew gum at the same time. And that goes back to the point I made earlier about knowing where your North Star is. In any situation, I'm going to zero in on the communities that are most impacted, that are most marginalized, that have the fewest access to resources. Because guess what? The same people who were dying from HIV are the people who were dying from cancer, are the people who died from COVID, are the people who were dying from infant and maternal mortality and from heart attacks. And so, if you can focus attention on those individuals with whatever the problem du jour is and get them resources, then you're going to be able to improve outcomes. Across a number of different disease areas, and again, not get so caught up in the whack a mole.
And so, I suppose, speaking about one of those headlines you mentioned, the National Institute of Health, obviously facing significant budget cuts, especially I think to external research and funding, and ultimately universities. As someone who's long advocated for health equity and innovation, how do you feel watching those cuts play out?
Well, there's two sides to this. One side to this is that our leaders in Washington D.C. have been incredibly irresponsible over several decades and several administrations, and we have to acknowledge the fact that you can't keep spending money that you don't have, and so we are reaching a crisis point in America where our credit rating is going down, where we're continuing to kick the can down the road to our children and our grandchildren and our great grandchildren. And we have to deal with the fact that we can't keep growing government and services without paying the bill. That is a fact. Now, that said, I've been very displeased with the way the current administration has gone about addressing and/or in some cases using that issue. Once again, politicians know never waste a good crisis. Um, and the blunt cuts to public health and to research are I the saying again, penny wise, pound foolish, but they aren't even penny wise. They just come across, quite frankly, as foolish. They're hurting us in every way. I saw a study just today about the cuts at the FDA, and the Congressional Budget Office estimates that the current cuts at the FDA mean that we're going to see 53 fewer drugs approved every year, because the FDA is not going to have the staffing to actually safely evaluate and regulate these medications. That stifling of innovation is going to hurt us all, because those are cures for cancer, those are cures for rare diseases. Those are devices that will allow us to live healthier and longer lives that are not going to be approved because of the cuts. And you mentioned NIH. America, and in particular NIH, has led the world in terms of research and in terms of funding for research. So you again are going to stifle innovation. I think that it creates an opportunity in many cases for philanthropy to step in, and I think that's going to be the next evolution. But I am concerned about what happens in the interim as we sort things out, because right now we've turned the spigot off in terms of our ability to develop new treatments, new therapies, new remedies for many of the problems that ail the United States and the planet.
You've spoken, and I suppose you're in a very unique position about kind of connecting with people across the aisle. And I know you've mentioned Bill Clinton as somebody you bonded with at an event or a conference or
Mhm.
something you were at, and where both of your teams were not particularly pleased about that happening. And you've also been open, I think, about facing racism, and in your earlier career, you've spoken about that at Ames.
Mhm.
What do you think? We live in such a polarized time. What are your tips for kind of reaching across the aisle? And I know for a lot of people,
Mhm.
even the idea of that is kind of not something they necessarily want to do. But you've had to sort of face that yourself throughout your career and life. And what would you say uh, to help folks in that situation?
Well, number one, I always remember that there is more that we share in common with one another than there ever could be that separates us. And unfortunately, we live in a world where many people capitalize on and have monetized division. Every TV news outlet focuses in on a subset of the population and really tries to anger that subset of the population by making them feel like everyone else is against them, whether it's Fox News or whether it's NBC News. The same thing for newspapers. Everyone know, most people know the Wall Street Journal leans right and the Washington Post leans left. These aren't news outlets anymore. They're more editorials, that are covering new stories of the day with a particular bent. And so that's incredibly unfortunate. Uh, there's a saying, those who don't know their history are doomed to repeat it. And I think a lot about historical figures, and I personally try to think about what some of the leaders I respect have said and done. Mark Twain. Mark Twain famously said, "Travel is fatal to prejudice, bigotry, and narrow mindedness." And what he was talking about there is that when you travel, when you meet people from different environments, when you get outside of your own bubble, you get to see the world through their eyes. And that's one of the things I love about Ames. I get to hear about how they're doing things in Ireland, how they're doing things in Italy, how they're doing things in other parts of the planet. And you know what? You realize that there's multiple ways to skin a cat. That there's not one right way to achieve a particular health outcome in many cases. And so it makes you, I think, a better person, a more informed person, but also a more tolerant person. And so I focus on that. I also, again, don't want to throw religion into this too much because people have different religions, but I also tend to lean on my Christian faith. And one of the frustrating things to me is there are so many Christians out there who seem to forget that the key word in Christianity is Christ, and that Christ preached that you should love your neighbor. And it's hard. It's hard to do, but again, I try not to assume bad intentions on the part of people, and I try to get to know them. And I've lived in Berkeley, California, where I've had meals with people who proudly call themselves socialists. And I have lived in Indiana, where there are people who proudly call themselves MAGA, or back in the day it was Tea Partiers. And I've come to realize that they all love their kids. They all want to create a world where their kids can be successful and healthy. They all, in general, want the same things. They may see different pathways to getting there, but they share the same goals. And if you start with the goal and then work your way back to the policy, I've found that that is a much more effective route than starting with the policy and trying to force your way towards the goal.
Um, yes, I suppose traditionally, being Surgeon General could be seen as the pinnacle of a career. And you were quite young when you took it on. But with the sort of polarized environment that we live in, has that impacted your career for better or worse, or is that something that's still evolving?
Well, again, we are in a incredibly polarized environment, and what's interesting is some people have ridden the environment to success, and some people have suffered. If you are willing to embrace this idea of partisanship, you absolutely can ride it to the top. And again, I don't know him and have nothing personal against him, but an example of this is RFK Jr. He's very much capitalized on the MAGA movement to create this Maha movement and this idea of us versus them, this idea of government bad, science bad, those people bad. Our group knows better than anyone else, and those other people are evil. There's the opportunity to do that. That's just not who I am. I'm a person who is always going to try to find common ground, and that's what really makes me sad about the current environment that we're in, is that I really do feel like 80% of the people agree on on the majority of issues. But you've got 10% on the extremes on either side who've been able to capitalize on social media, on cable news, on the partisan media that exist out there to control the conversation and really hijacked the country and the conversation from the rest of us. But I do believe firmly that kindness and loving one another is the way forward, and eventually it will win out. Again, you know that I like to quote people. I think about Martin Luther King. And Martin Luther King, said darkness cannot drive out darkness. Only love can do that. And so I really do believe that to be the case. They haven't beaten me down yet to the point where I've given up. And so if you're a Republican, I'm going to talk to you. If you're a Democrat, I'm going to talk to you. If you're a libertarian or identify as something else, I'm going to talk to you as a neighbor, as a person first, and not as a person affiliated with a political party first. And again, that's what I love about Ames. When we go to Ames, people aren't there as Republicans or Democrats or whatever their party is. They're there trying to figure out how we can all be healthier and more innovative and advance some issues that we collectively care about.
Would you take the role again?
I would never say no off the bat. I would always listen. Um, One of the things that I say to people is that you should always be willing to entertain the idea of serving in some way, shape, or form. But that said, different people have different seasons in their life. And so I'm at a season now where I really need to focus on my family and my kids. But once I've got two in college and one in high school. Once my daughter goes off to college, I'll be in a different season in life, and maybe that'll be an opportunity for me to get back involved again. So I would never say never, but right now I'm trying to find other ways to be influential. And so it's a great question. It's one that I have had with other people before. Sometimes you can have influence within government. Sometimes you can have influence in academia. Sometimes you can have influence in the private sector. I would argue that working for an entity like a Walmart or an Amazon or a CVS or United Healthcare, you can have just as much influence over healthcare delivery as you can as Surgeon General of the United States. And so it's really about finding out what that role is where you can have the largest impact that fits in with where you are in your season of life, not necessarily about trying to get to one particular type of role or place at any given time.
Would you consider running for office yourself?
I I absolutely believe that we need to get more involved with the political system. In America, only about 80% of the voting public participates in presidential elections, um, and that drops to 40% in off-cycle elections. And so I think that it's important that we all understand that democracy doesn't work if people don't participate in it and if we don't have good candidates. And I will continue to try to encourage and support good candidates. But again, for me, at this season in life, I don't see me running for office anytime in the near future. And I think it's important to clarify that the roles that I've been involved in were all appointments. They weren't elected, and they're very different types of roles. When you're elected, you're a part of the legislative branch. When you're appointed, you're a part of the executive branch. And so there's different powers and authorities, and maybe one day down the road, I'll consider, getting more involved in the legislative side of things. But that really does take a tremendous toll on your family. You've got to be out campaigning. Your family then comes under additional scrutiny. And so, a long answer to your question, but again, I would never say never. But right now, I don't see that on my radar for the near future.
Fair enough. You've been around a lot of politicians, obviously, particularly when you were Surgeon General. What sort of surprised you about them most, if you can
Well,
generalize?
what surprised me, um, is something I said earlier, that there was very little difference when you sat down to have a meal between people who were on different sides of the aisle. They again. I'm someone who I have three kids. I'm a dad. I'm a proud dad. I love talking about my kids, and most people who've met me will know that usually within about 5 minutes of meeting me, I've asked them or we found a way to talk about whether or not they have kids. And so that is something that I think I noted and that people should remember is that there isn't that much difference um, from one party to another in terms of the things that they care about on a day-to-day basis. And I think that's why local politics is so much more important. Um, and so much more effective than national politics, because local politics, it's just people trying to figure out, okay, how do we get the buses to run on time? How do we get our schools to be the best that they can be? How do we make sure our police department and our fire department are resourced to be able to protect us? It's not a lot of these bigger, more abstract issues where they're playing with monopoly money. I mean, the difference between millions and billions and trillions, at a federal level as opposed to at a state level, the difference between a few $1,000s can mean all everything at a local or county level. So I think that was um, important to me. And on the opposite side, and I hate to go cynical here, but I remember being in D.C. and a legislator telling me that there was really no difference between Republicans and Democrats beyond who they wanted to give the money to. And so, as I mentioned earlier, we have a crisis where people were pointing out that we couldn't afford to continue to have our deficit grow, and then the same people passed a bill which grew our deficit which is projected to grow our deficit by trillions of dollars. But they took money away from one group of people who were previously getting it to give tax cuts to another group of people. And you can have your political or partisan opinions about who was most deserving of that money. But the fact is, the crisis was supposed to be that we didn't have the money in the first place to spend. And, the answer to the crisis was, hey, let's spend some more money. And so, again, from a cynical standpoint, it really surprised me that people tend to behave in the same ways at a um, federal or national level, no matter the party. It's just different constituencies who tend to benefit from it.
Um, what's your passion today? Is life after being Surgeon General a little duller, or is it a welcome change?
Well, great question. It is not at all duller because we have and I think I can say this fairly without sounding too partisan, an incredibly contentious administration who's doing some uh, incredibly consequential things in regards to health. And so I'm finding that there's even more for me to weigh in on and comment on in the health and technology and science space now than what there was when I was Surgeon General, and more of an interest for it, a steady drumbeat. Like I said, literally every day there's some new news story in it that leads with this has never happened before, and, and every single day there's something that's never happened before in the health and scientific world that we have to comment about. So certainly not boring. But what I'm focusing on now is really my family. My cost for public service. I missed a lot of the last decade of my kids growing up, and so I'm really focusing on trying to help them grow into successful young adults, and leaning into academia. I really enjoy being at Purdue University right now. I'm concerned about the attacks on academia that are going on, and the academic independence and academic funding that's going on. The calls to pull down the Department of Education again, I think reflect frustration with a lot of what's wrong, and we can't ignore that there's a lot that's wrong with the system. But again, to demonize teachers and schools and to just take away funding altogether is something that concerns me. And so a lot of what I'm doing is trying to lean into leveraging the power of an institution like Purdue. That to continue to innovate. We've got a great engineering group at Purdue, and so we're looking at at wearables and biomedical engineering. I talk about inflection points. AI is going to, I think, be the thing that we're looking back at 50, 75 years from now and saying that is when medicine and healthcare really changed. And so that's the positive, I think, to leave here with the conversation about a lot of the negatives around cuts. The hope is that some of the innovation that has been stifled by lack of funding and research can be accelerated on the other end by by leveraging AI and new technologies. There's a hope that the decreases in the healthcare workforce that we're seeing can be made up for by leveraging again AI and new technologies to augment and to supplement the work that we're able to do, so that we can work smarter um, and faster in terms of diagnosing disease and in coming up with new treatments. And so I am very excited about that. But one of the things that I've talked about at Ames is that we have to make sure these new technologies are available in an equitable way, that everyone has access to them. I'm sitting here with you right now wearing my wearable that everyone has, my Apple Watch. Well, guess what? This Apple Watch costs $400. Not everyone is able to go out and buy a $400 wearable to get their heart rate and diagnose their atrial fibrillation and to help them keep track of their step count and motivate them to be physically active. And so that's just one very tangible example that everyone can relate to, but all sorts of other technologies out there that are going to go to the haves and not to the have-nots, and have the potential to increase disparities, even as we are coming up with great new innovations.
Well, speaking of physical activity, and it's a good segue, I have a couple of rapid fire questions to
Mhm.
ask you. What do you do to stay active?
Uh, I I try to be standing and active. So when I'm in meetings, and the worst thing that that we do as health professionals is we love to go to meetings, and we have donuts and and coffee, and then we sit on our butts for an hour and listen to a lecture. Um, I try to drink a lot of water. I'm a tea person, and so I'll avoid the milk and the sugar, and I will stand. I'll find room at the back of the room and stand. I if I watch TV, my rule is that I have a TV in my basement where I have a treadmill set up, and my rule is if I'm watching TV, I'm walking. So it's the reward for me for walking. I try to incorporate physical activity into everything that I do. When I'm in a building, as long as I can find the stairs, and unfortunately, this is the way we design our environments and our buildings around us. It's oftentimes impossible to find the stairwell in a building. But if I can find the stairwell, more often than not, I'm going to take the stairs over waiting for the elevator. So just finding little ways to incorporate movement in your life, in addition to playing with my kids. I've told you I'll bring up anything I can to loop my kids into the conversation. One of the things that I really enjoyed doing was coaching all my kids in soccer, and so being involved with them that allowed me to spend time with my kids and be physically active at the same time.
So, is your least healthy habit then the donuts?
My least healthy habit are French fries. I like French fries. I actually don't like donuts. Too much. Every now and then I'll take a bite, but I do like French fries, and that's a problem with having kids. I finished off a lot of chicken nuggets and French fries in my day, and I wouldn't have to walk nearly as much if I could just say no to those leftover McNuggets or those leftover fries.
What is the best piece of advice you've ever received?
uh, The best piece of advice I've ever received, is the one that I, almost always, weave into a conversation or a discussion I'm having with audiences, and that's that people need to know that you care before they care what you know. And that's really hard for scientists and for health professionals, because we're taught that our credibility comes from what we know. Well, I'm an MD, MPH, all the letters behind my name, and that's a testament to how much I've learned, and that's why you should listen to me. But at the end of the day, that's not why people listen to other people. They listen to them because they trust them, because they feel like they have a relationship with them. They feel like that person um, cares about them, and so that's the best piece of advice I've ever received, and it's helped me a lot. One of the most powerful things, pieces of feedback that I get regularly, and this just happened to me yesterday. Someone came up to me. Um, and they said, "I remember you during the COVID press conferences, and you were always calm. You always spoke to me, spoke to people in a way that made it feel like you were speaking directly to them, not above them, not at them, not lecturing them." I believe it was Toni Morrison, or maybe it was Maya Angelou, who said, "People will forget what you said, but they'll never forget the way you made them feel." And so that's the best piece of advice I can pass along to folks is you're not going to lecture someone into behavior change. You really have to connect with them and create that relationship and make them feel and believe that you care about them. And then they will be more receptive to what you have to tell them from a health behavior perspective.
Who do you admire most in the world?
Ah, who do I admire most? Right now, I really appreciate the Pope, um, because the Pope has not shied away from taking on controversial issues, both of the last two popes, but really leaning into the fact that we need to lead with love. We can have differences on all sorts of issues, whether it's Ukraine and Russia, or the Palestine and Israel situation, whether it's transgender or whether it's guns. Um, but at the end of the day, if we lead with love, we'll more often find a positive way forward. And I've been very glad to hear both of the past two popes really. Lead with love and say that other people should lead with love.
Former Surgeon General Vivek Murthy has spoken about loneliness and isolation as a public health crisis. If you had to pick just one thing that you think is the biggest threat to our health and well-being right now, what would that be?
Well, no pun intended, the biggest thing is our waistlines. It's obesity. I don't disagree with Dr. Murthy that mental health, loneliness, isolation are huge issues. The two are symbiotic. And what I mean by that is if you're obese, you're more likely to have cancer, diabetes, heart disease. Um, you're more likely to have an array of issues, but you're also more likely to be depressed. You're also more likely to be isolated and lonely. And we know that in turn, people who are depressed or anxious will self-medicate with food. And it becomes a cycle, a negative cycle. And so I think what we need to do is create environments where people can be together. There's a great book that came out about 20 years ago, but it's called Bowling Alone. And the book talks about how back in the 50s and 60s, there used to be more adult gathering opportunities, bowling clubs. Men used to get together in bowling clubs. Um, and we've lost that. Again, to bring religion back into it, we know that fewer and fewer people are going to church. And that can have negative spiritual aspects, but it also means people are having less opportunities to gather as adults. And when you gather together, you tend to be more physically active. And you also tend to have better mental health. Blue zones. Blue zones are the places on the planet where they have higher than average numbers of people who live to be over the age of 100. And one of the things they found was the secret sauce of blue zones, or two things was they were physically active and they gathered together. I mean, so I don't think it's an either or. I think the two work together. As I mentioned, so Dr. Murphy is right. Loneliness is a predictor of negative outcomes, and obesity is a predictor of negative outcomes, and the two often co-occur.
Last question. What's next for Dr. Jerome Adams?
Uh, what's next for me is to continue to try to find ways that I can have an impact. And so I've been talking to a lot of private companies and a lot of people who I met actually at the Ames meeting, because private equity groups, I think they're innovating. They have the ability to rapidly scale up innovation, and also the ability to rapidly pivot if something goes wrong. And so I'm intrigued by that space. I'm intrigued by the idea that you can come up with a great idea and you can pitch it and you can get 10, 15, $20 million behind it. And you can roll it out very quickly, and you can get feedback. And if it works, then you can very quickly scale it up. It's a lot quicker than academia. It's a lot quicker than government. And so that's the space that I'm learning about and leaning into right now, and trying to um, uh, take advantage of the crisis that we're in many ways right now from a governance standpoint, to figure out, okay, what's the way forward. The problems that they lay out are real. They are real, and they're willing to disrupt. And so again, we don't want to waste a good opportunity, um, uh, to really change these broken systems that are plaguing our national and global health.
Dr. Adams, thank you so much for joining us. It's been a pleasure. Thanks for your service and your leadership. And thanks for being a friend of Ames.
Thank you. It's been fantastic.